Ago. There are 20,042 confirmed aggregate cases of coronavirus in Victoria since the beginning of the pandemic. That is just 14 new cases since my update yesterday. 9 of those 14 cases are linked to known outbreaks. 5 are under investigation. 6 cases were reclassified. There have been 761 deaths due to this global pandemic, I'm sorry to have to confirm. 5 since our report yesterday. This is an overall increase of 4 since the last report, as 1 deceased case was reclassified. Of those 5 additional deaths, 2 males and 2 females in their 80s, 1 female in her 90s. We of course send our best wishes and extend our condolences and sympathies to those 5 families. All of those deaths are linked to aged care outbreaks. There are 94 Victorians in hospital. 8 of those are in intensive care and 5 of those 8 are on a ventilator. A total of 2,575,457 test results have been received since the beginning of the pandemic, which is an increase of some 12,461 results since yesterday. Can I thank each and every one of those almost 12,500 Victorians? It is such an important thing to come forward and get tested, even if you've got the most minor of symptoms. That's what gives us certainty, the clearest picture of where the virus is, and allows us to take safe and steady steps towards a COVID normal. Again, if I can urge and ask all Victorians, don't put it off till tomorrow. Don't wait at all. If you've got symptoms, however mild, please come forward and get tested. It makes a huge difference to keep your family safe and to keep every family across the state safe, and to get us open again, to allow us to take those safe and steady steps with the clearest picture of how much virus is out there. There are 4,267 cases with an unknown source, a decrease of 7 since yesterday's report. There are 117 healthcare workers who are active cases. We send them our best wishes, and to all of their colleagues we extend our thanks and our praise for the work that they do every hour of every shift right across our state. There are now just 743 active cases across Victoria. That number continues to fall. In terms of the metro regional split, as at the 20th, there are no additional cases in regional local government areas. In terms of active cases, there are just 26 active cases in regional local government areas under third step restrictions. The rolling averages to the 19th of September are Metro 36.2 cases, regional 1.8 cases. That is proof positive beyond any question that this strategy is working. These numbers are coming down. We are, thanks to the hard work of every single Victorian, the vast majority of Victorians who are following the rules, doing the right thing, getting tested as soon as they have symptoms. That's why we're seeing these numbers come down, and that's why we will continue to see them come down in accordance with our roadmap to COVID normal. There, of course, will always be debates about timing and whether we're on schedule, ahead of schedule, all of those things. Ultimately, these numbers are a cause for great optimism and a positivity, I would hope, right across Metropolitan Melbourne, just as regional Victoria this week has taken 2 big steps to open up, and we're seeing stability in those numbers. Days this week with no new cases across regional Victoria despite significant testing activity. We will see the same thing occur in Metropolitan Melbourne, and we'll do it in a safe and steady way. There's no good opening up too early. There is no good letting our frustration get the better of us, because all that will mean is that everything Metropolitan Melbourne has given, everything that everyone has done to produce these low but still not low enough numbers will count for nothing, because we'll be open, yes, but not open for very long. This is a good day though, a day where Victorians can be proud of the work they've done, their commitment, their resolve to see this off, to defeat this virus in its second wave properly, comprehensively and sustainably. We can't hope to keep numbers low until we first get them low, and that's where the trend is going, and that's all down to the hard work and the amazing efforts that Victorians are putting in right across our state. I can not give you aged care or disability facility settings. They'll be in the Chief Health Officer's release a bit later on today. Those numbers just weren't to hand. But just by way of one example, the Hallam outbreak that we've talked a little bit about this week, which can I thank and congratulate our contact tracing team. This has been expertly handled, but that is now at 40 cases. So it just gives you a sense of one person, just a single person, can infect many, many other people. And the contact tracing work that has gone on there has seen us pull that up. There are still, I'm sure, close contacts and others who will be very much monitored to make sure that if they exhibit symptoms that we can further isolate them. But they're all isolated at the moment. We believe we can pull it up at that number, but again, it's always subject to testing and events as they unfold. But whether it's there or in Colac just a couple of weeks ago, where one person finished up infecting through chains of transmission 25 plus people. This is wildly infectious, it moves very quickly, and if we pretend this is over just because we want it to be, and we all do, then we will see more and more of these cases, and it gets very difficult when the place is open to pull something up at 30 or 40 cases. Invariably it becomes 300 or 400, and that of course would set us back, and all the good work we've done, all the sacrifice, would be worth very, very little indeed. Now, Martin is here, both of course primarily in his capacity as the Minister for the Creative Industries, but he can answer other questions I'm sure from other portfolios. He's going to announce a very significant package of funding to support some of our iconic live music venues, who of course the pandemic has hit very hard. This is the capital of live music in our nation. I don't think anyone could credibly argue against that, but we've got, obviously with the circumstances we now face, there are many venues that are closed, many artists, many of those who support that sector, a sector that's worth $1.7 billion a year to our Victorian economy. They're doing it very, very tough. Can I thank leaders in the music industry, whether it be Michael Kadinsky in the Mushroom Group or many, many others, who have always been creative and look for ways in which we can provide a platform for people to continue to perform, continue to do what they do unquestionably better than anybody else. But these are very challenging times, and that's why these grants, I think, are a recognition of that and important support for those venues, so that when we get to that COVID normal, those venues can start again and can still be there and be an iconic feature of our city and state. I'll now throw over to Martin.
Thanks, Premier. So I'm joining you today to announce a series of packages that will see Victoria's $1.7 billion live music industry be COVID ready and COVID safe to come back when restrictions allow. Victoria, and indeed Melbourne, has the highest number of live music venues per capita anywhere in the world, and that underpins the whole rich ecology of our contemporary live music sector and the tens of thousands of jobs and the thousands of creative musicians that it sustains. But of course it was one of the areas first and hardest hit, and under the roadmap to recovery will be amongst the last of amongst all the creative sectors to be able to return to a COVID safe and COVID normal operation. So making sure that the venues, making sure that the whole ecology of the workforce, particularly the creatives, and indeed protecting those venues is what we're here to announce today. So a $13 million package is being rolled out today that will see hope and recovery at the heart of our contemporary music system. 106 live music venues in an initial tranche will receive support to keep their businesses going, from very small venues to venues of over 1,000 people. These are, as Paul Kelly has described it, this is where the universities, this is where the training for our music system and our music ecology happens. So to keep those venues going through this $9.6 million allocation until their COVID plans can be applied and until their safe reopening can go ahead is at the heart of this package. In addition to that, we'll also announcing a series of measures to actually protect those venues, which the industry has made very clear is a priority during this shutdown. The state planning scheme will be amended to make sure that the value, socially, economically and culturally, of live music precincts will be reflected in the state's planning scheme, and we will be strongly encouraging all local government areas to move quickly once that amendment has happened to protect not just iconic local venues, but live music precincts wherever they might be right across the state. We want to make sure that in this COVID shutdown period that venues are not at risk and that councils are given the tools to make sure that live music venues can keep pumping out rock and roll and keep pumping out music for many years to come. And then finally, there's also a $3 million package for support to a whole range, further supports for a whole range of musicians, of festivals associations, of peak bodies, of care crews as a part of the Support Act, support to make sure that the well-being of the whole set of workforce that goes with our live music industry is protected, and that is also looked after, to making sure that not only do we have the venues, the planning schemes, but we have the creatives ready to go, the whole workforce ready to go when the COVID safe plans allow. And the last part of the announcements today is to also roll out our annual Pride events schedule and encourage, as of this week, applications for our LGBTIQ community to take forward Pride events right across the state, both online and in a COVID-safe way, so that the rich diversity of the Victorian community can be celebrated and reflected. So putting all that together, that's a $13 million package that brings to some $90 million worth of new funding that the Victorian Government has allocated over the course of the pandemic to make sure that our reputation as the creative beating heart of the Victorian and Australian cultural economy continues. And I look very much forward to the day in which we can all go back to live music venues, but until such time as that is safe to do so, to make sure that we are as well positioned as we possibly can to rightly claim and sustain our position as the live music capital of not only Australia, but indeed the world.
Happy to take any questions you have.
14, did you like that number?
Yes, that is a very good number. It's certainly better than, say, 13,000 cases in France, which is what they're dealing with at the moment. This is, as we've said so many times, and this reality cannot be denied, this is a wildly infectious and deadly virus. And whether it be those who are frail and aged, those who of any age who've got underlying conditions, or those for whom this presents as a chronic illness and is not easily shaken, this is something we've got to get these numbers down. And I thank every single Victorian for the part they're playing in these numbers. This is a day of hope and optimism. This is a day that, beyond any doubt, this strategy is working, and we will get to that COVID normal, and it will be meaningful and sustainable. It'll be able to be locked in. We're not going to spend 2021, I'm determined, we are not going to spend 2021 bouncing in and out of lockdowns. And we will only achieve that outcome, a lasting COVID normal, where we can begin the process of economic repair, of healing, and dealing with the very considerable damage that this pandemic and this virus has done to jobs, to livelihoods, to families. Once we get the health problem under control, 14 is a very good number. I'd like it a little bit lower, and that's what we're all got. We just have to stay the course to get to that point.
You said there's no good in opening too early. Would there be some aspects of the roadmap that you would consider bringing forward, a certain lower risk like childcare or any other schooling?
Well, we will be guided by the case numbers, but not just the numbers. I want to be very clear with every single Victorian. It's not just a numeric or a quantitative exercise. you've got to look. There are different types of cases, so mystery cases, cases that are contained, cases that we've got less confidence that we've actually contained it. The narrative, the story that sits behind every one of those cases is in many respects just as important as the case numbers themselves. So that's why we constantly review assumptions that are part of modelling, get replaced by the real numbers that I report here every day. The whole epi picture that sits behind every day's data gets put into that model, gets updated, gets refreshed, and of course we've made the point quite clearly that we always reserve the right to, and indeed we always apply the principles of common sense as well. If on the last day of a 14-day cycle, and we were about to tip into to hit a key trigger point, and we had 6 or 8 or 10 cases, but the 10 cases could effectively be treated as one case because we had our arms around those people and they did not pose a risk to spread to others, then we would always reserve the right to factor that in.
Just on that, what does the narrative about our 14-day average reveal at the moment? As in, do we have most cases under control or a majority of them mystery cases?
No, we're seeing the number of mystery cases fall just as the total number of cases fall. We're seeing very significant outbreaks that are being pulled up quickly and that are being appropriately contained. The Hallam example, 4, 5, 6 households, starts with one person, finishes up. My latest advice, but again they'll be confirming data in the show release later today, is that we're at about 40 cases now. There'll still be some others who are close contacts and will be monitored to see if they exhibit symptoms in the days to come. But I think the narrative matches with those numbers. We are seeing less and less cases, and we're seeing the sort of enforcement, as in the enforcement of protocols and procedures, the sort of containment, I should say, that is exactly what we need to continue to drive those numbers down and then to keep them low.
Just on that Casey cluster, you mentioned 4, 5, 6 households. A few days ago we found out there were 5 households involved. Has that increased to 6 now?
No, I'd leave it to the show release to speak to that, but sometimes there can be cases that are not necessarily linked, but upon further investigative work they can become linked, but I'll leave it to the show release to give you any updates there.
And the increase from 30 to 40?
34 to 40, so there's 6 additional cases.
So the 6 additional cases, are they part of a household or are they workplace contacts? Or?
No, they're part of households, plural, I think. But all that detail, to the extent that it wouldn't impinge upon anyone's privacy, that'll all be reported in the show release later on today.
Do you know if there are more hospitalisations associated with that cluster?
I don't believe so. In fact, I think there might be less people in hospital than there was, which is obviously a good thing.
And how is testing going at the sites out there then?
I haven't got an exact number. That'll come to me a bit later on today, but in some conversations overnight, people were pleased with the number of people that had gone to the pop-up clinics, and I think there are 9 or 10 testing sites out there anyway before those pop-ups were set up. I think it's in the order of 300 or 400 people that I think have been through the pop-ups, but if that's not in the show release, I'll make sure that we can get you an update. We're not expecting thousands to go through those. They're additional, and if they even prompt a few hundred people to come and get tested, that can make a massive difference. I'm not for a moment discouraging anyone. If thousands want to come and get tested because they've got symptoms, that's exactly what we want to have happen. But it's fair to say, across that Casey and Greater Dandenong corridor, we've made testing easier than it is perhaps in any other part of the state, just by virtue of the number of permanent sites and the pop-up clinics, and people are going. And I think our doctors are confident that that's reflective of the amount of symptoms that are out there, and they're not uncomfortable with the number of people that have tested. But we'd always urge anyone else, particularly in that Casey Greater Dandenong corridor, if you have any symptoms at all, the most powerful thing you can do is to come and get tested, to protect your family, to protect every family. And I just make the point, it's an honourable thing to do. It's an absolutely honourable thing to come forward and get tested. There's no sense of shame, there's no sense of stigma, there's no judgment. If you've got this and you've got symptoms and you come forward and get tested, you test positive, you're playing your part. You're doing exactly what you need to do in our collective fight against this virus, and at a very personal level, for your own health and the health of others. Those are the people you love, the people that you live with, the people that you're closest to. They are well served, mightily served, by us having the knowledge that you've got it, and then we can put a plan in place for you and the people that are the most important to you.
Given today's low numbers and the downward trend we're seeing, If we reach that target of 5 new cases over the 14-day rolling average, are you still ruling out lifting restrictions before then?
Well, let me give you this week's example. So we've set a range of between, or the most relevant target, the 28th. We set a range of between 30 and 50 cases, and we are on track to meet that. The passage of time, even though it is a 14-day average, it's a rolling average, the passage of time, so multiple days and weeks that you can achieve those low numbers, as frustrating as that is, it kind of validates or supports that those numbers are a real and an accurate reflection of how much virus is out there. To do this just off one single 14-day period, or to do it off 1 day or a 5-day grouping, that runs the risk that you're not getting the most complete picture. We're confident that come Sunday we'll be able to make some significant announcements, because we'll be in that 30 to 50 band, but that should lead to no sense of complacency. We've just got to stay the course, all of us, every single Victorian, by following the rules, playing our part, doing the things that matter, not doing the things that contribute to the virus spreading. We will update and make sure that the plan reflects the data we're seeing, the amount of virus we've got in the community, but it's got to be done safe. And you only get one chance to do this, and we want to do this properly. And I don't begrudge people having a different view to me, different opinions. That's a perfectly healthy thing. But the loudest voices are not going to win this debate, because it's not a debate. The evidence is clear. The science could not be clearer. If you do this too fast, well, then we'll be back in lockdown again. And none of us want that. As frustrating as it is, I'd love to be able to announce that everything's opening up tomorrow. Of course I would. And maybe that'd be something that would be praised by many people. I don't think that praise would be around only a few weeks later when we had to close the place down again. So we only have one way to go here, and that's to do it safe, steady, and then lock it in, and then defend those low numbers through an enormous amount of effort all throughout 2021, assuming we get a vaccine in 2021.
So the loudest voice isn't, ironically, the loudest voice isn't going to win, but who is that to you, the loudest?
Well, there are many people that have different opinions, and they're entitled to those opinions.
Who's the loudest?
Oh, well, I'll leave it to you to make that judgment. That's a very qualitative thing, and
In your
I'm not a commentator. The key point here is this: people are right to be frustrated. I'm not criticising people for being angry and being upset with this virus and what it's done to us. Absolutely, but at the same time, this is the only way to get to a COVID normal that we can defend. And not just from a Victorian point of view, all the international evidence. Have a look at Europe at the moment. It's heartbreaking to see all that those communities have given, all the sacrifice they've made, and now they've got cases running perhaps more wildly than their first wave. Some of these notions as well, I see a bit of commentary around the place about how, death rates in second waves are lower. That's not what the data's saying. That's not what the data in Europe is saying. You've got to see it off, and that's exactly what we have to do. I don't begrudge people having a different opinion. I'd never criticise someone for being angry with where we find ourselves. This is a really challenging time in the history of our state, but it'll only be defeated if it's defeated properly.
Well, a lot of people are angry at you.
Well, that's entirely a matter for them. That's the job that I have. This is not, as I've said to you many times, I don't think I could be any more frank. This is not a popularity contest. It is a global pandemic. What's more, politics, and particularly cheap politics, no interest to me. Absolutely no interest to me. Because it doesn't work. If politics worked against this thing, well, who knows? We'd be in a very different set of circumstances. There's a bit of that going around. That's fine. That's not the job. Some people have time to do that. I don't, and the facts tell me that it just doesn't work. But let's not get into a too negative discussion today. These numbers are a reflection of the hard work that all Victorians are putting in. And once we get these numbers down even lower, that's when we can embark on the biggest package of stimulus and economic repair that this state has ever seen. And that will be about jobs and skills and strength, and getting Victoria back to where we are at our best, leading our nation. 500,000 jobs created in this state over the 5 years before the pandemic. We'll get back to that. We will get back to that position of leadership, and the nation needs us to, because this is the engine room. This is, on any measure, this is the engine room, and we will play our part. And we've just got to get this health issue dealt with first. You can't repair the economy until you've got that COVID normal, and you've got good prospects, very good prospects of being able to lock that in. for potentially a very, very long time.
With the 14 new detected cases,
Yes.
is there a metric that gives you a guide on how many are still out there that are undetected? Is it?
Yeah, there's some. I'll get Brett or one of the public health team to include some analysis in this, if not to you guys separately, or maybe in the CHO release. But what you always have to watch for when testing numbers perhaps come down a little bit, but these numbers today more than yesterday. I'll boldly predict that tomorrow and Tuesday's numbers will be less than this because weekends are lower. That is not an invitation to not get tested. And this is something that's happening in New South Wales as well. I just say to anyone who's got symptoms today, don't put it off until Monday or Tuesday. Go and get tested right now. Go and get tested today. It's the most important thing you can do. But there is a metric, percentage of cases versus tests. So how many positives are you getting? They're all within absolutely acceptable ranges, and the amount of testing that's being done is still well and truly above what the World Health Organization would call a fair number. There's a range of formulas, but we're all on the right side of those. So, again, we've got no flu symptoms hardly at all out there. There's not much cough and cold out there. It's if you've got symptoms, it's almost high likelihood that you've got this. And if you come and get tested, we can look after you, and we can help you look after the people you love the most.
14 new cases. 14 new cases. Are you concerned that 5 are still under investigation and that they might end up being mystery cases?
No, I'm concerned to make sure that we go through a proper process with every case, whether it's 14, 40, 100. We go through a process, a rigorous process, and the sort of investigation, when we say 5 are under investigation, that's the sort of work that saw one case in Hallam become 40 cases with a management plan in terms of health, the health of each of those people, and the likelihood of them infecting others. So that investigative work is very, very important. And if I might say, just to say thank you to all of those teams, whether they be Monash Health, the public health team in the city here, and many, many others, that outer southeast outbreak has been handled in an expert fashion, and that's why it's pulled up at 40. It could grow, but we've got containment plans in place for anybody who might be either is infected or could be a close contact of one of those people. That's obviously much preferable than it being 300 or 400, and that's how very quickly 30 or 40 people can become 300 or 400 infections very, very quickly.
Do you expect the 5 will be mystery cases?
There's no expectation about the results of an investigation until the investigation is concluded.
Just on that Casey cluster, have you been able to determine the upstream where patient 0 contracted the virus?
I don't believe that's yet determined, but there'll be work going on around that, and if and when we can provide further information about that, we will.
Do you have any idea how long that investigation might take?
No, it'll take as long as it does, and I have to foreshadow that it may well be that we never know where that index case was, that very first person, where the first person among these 40 got it from. We may never know. That's the nature of having, from much more from an historical perspective than a contemporary perspective. We've had so much community transmission around the place that some of those riddles will never be solved.
New South Wales has been testing more than Victoria in the last couple of weeks. How, when we go forward from here, will you plan to keep testing rates high, especially when we've had so much lockdown fatigue? I'm talking about
Sure.
2 months down the track.
Sure. Look at had a conversation with Gladys on Friday, and their numbers on the weekends have been down around the 10s, which is not too different from what we've been reporting on Mondays and Tuesdays, being of course Saturday and Sunday results. So that's a challenge. I think it's probably motivated. The cause is slightly different. I think people are out and about in Sydney, and maybe they'll choose to do other things that are more enjoyable than going and getting a COVID-19 test. But they're facing, for different reasons, the same challenge. And that's why they've been running a campaign about not putting it off till Monday. And I'd only echo that. Don't put off what you can do today until tomorrow. And there's arguably nothing more important than, if you've got symptoms, go and get tested. And do it today. Not tomorrow, not the day after. Because sometimes that period of early symptoms, and indeed when you're pre-symptomatic, can be the most infectious. That's the most dangerous time in many ways. In terms of once we get to the other side, when the place is open, then I think that there's a link, I think, between the amount of permitted activity and the amount of people that get tested. It's also how much symptoms are out there. Logically, you would be doing more tests when you had 700 cases a day because you've got more people that have got symptoms. But we'll find that balance, and I think that people, once they see the results of all their hard work in the community being much more open, the economy being much more open, people will jealously guard that, and they'll know this is not a zero outcome. This is not we're not trying to eradicate this. We're trying to control it, suppress it, and then keep those numbers low. So every person who goes in, December, January, whenever it might be, and gets a test, even if they're positive, they're doing the best of work. Because then, as I said, we can wrap our arms around that person, protect them, protect their family, and protect the overall settings, and leave the place open. It's when things bubble along and get to very big numbers, and you don't know, and the proxy for testing becomes a number of people who are being admitted into hospitals, needing machines to breathe. That's when you've got a real problem. So you're right, Dougal, testing will be very important, and we'll look at lots of different innovative ways to get as many people as we possibly can tested, and we'll have a bit more to say about that, particularly in some high-risk settings soon.
Would you expect the numbers, say, across summer to be up around 20,000 then, or would you say...
I'd probably resist putting a number on it because we've not had a summer with COVID-19, and we've not had a summer certainly, or we've not had any extended period where we've had rules that were as COVID normal as we hope to get to by the time summer is well and truly here. In terms of Christmas and the New Year period, we'll be doing everything we can, and throughout 21, to have as many people get tested as possible, and to maintain those test rates. The number, it's not so much a magic number of 10, 20, 30, whatever it might be. It's a number that we believe, and the experts tell us, fairly represents how much virus is out there. And it only becomes a problem when the numbers are so low that the percentage of positives creeps up, and that's when you say, okay, there's more out there than we think. We're not at that point, and to have more today than yesterday, so these will be predominantly Friday numbers, that is a good thing. But again, I literally cannot say it often enough. Any symptoms, don't put it off. Get tested today. It is the most important thing you can do for you, for your family, for every single family.
On contact tracing for New South Wales, it happened on Friday, but when will we be switching to that model that New South Wales has adopted? In relation to? The Prime Minister said that we'll be switching to everyone nationally. We'll be following New South Wales contact tracing program.
No. I think I didn't see the Prime Minister's press conference after National Cabinet on Friday. Is that what you're referring to?
Yes, that's what I'm referring to.
Well, no. I think what the outcome from the National Cabinet discussion was that, in fact, the IT upgrades that Victoria has made will in fact become the national template, and we're working specifically with New South Wales, given the disease profile is similar in both states, more so than in others. A little bit in Queensland as well. You might say that Eastern Seaboard is in a very different position to, say, the Northern Territory or WA. We're working very closely with New South Wales so that they can essentially adopt the IT system that we have put in place. I'm not sure what the Prime Minister was, or what you're referring to beyond that.
He was saying that we'll be following nationally the contact tracing system in New South Wales, which he had previously
I'd need to look at those comments, but what I know is that as a result of the trip to Sydney, it was agreed on Friday that we would, all of us as a nation, adopt to the best we can, because IT systems, having them talk to each other, having the kind of interoperability that you need is not an easy thing. But in the first instance, New South Wales and Victoria will be working very closely so that we can have the same system. That is to say, the system that's working here in Victoria will be rolled out, or at least be able to speak to every single other state and to have a national platform, if you like. Beyond that, in terms of one of the differences with the way New South Wales operates, and it's a feature of low numbers, and it's a feature of being open. So, for instance, today, I woke up this morning to see some reports of a taxi driver who's tested positive up there. They've been able to list a whole range of locations. They're pubs and clubs and different places, restaurants and all sorts of different stuff. That makes sense because those venues are open. So, of course, they'll know that there's been trips made there. They'll know that there's potentially people who have been exposed to this particular person. That's become more and more a feature of our contact tracing. For instance, the Colac outbreak, the Latrobe Valley outbreak, and indeed the pop-up testing and some of the messaging we've done to the southeastern suburbs is a direct function of that also. So you'll see more of that. Bit like the app. The app comes into its own once you open, because that's when you're spending time with people that you don't know, as opposed to at the moment, sadly, but absolutely critically, people are spending time with people they do know because they're in their homes until we get these numbers down.
Just this morning.
Oh, sorry. Could I just very quickly follow
Sure.
up on Dougal's question? The suburban contact tracing hubs, when will they be completely
Soon,
rolled out?
we'll have some further. Well, I just want to make a couple of points. We'll do that very soon. We'll have more to say about it. That is much more a maintenance exercise. That local knowledge will, I think, for instance, they've come into their own in regional Victoria once we got numbers very, very low. They will come into their own in the suburbs of Melbourne once we've got those numbers very low and we start to open up. Quickest response, local knowledge being used, all those things. But if you look at the Hallam example, Monash Health, essentially acting like a suburban public health team, were able to do a stellar job, amazing job, to put wraparounds and controls on those people and to limit the spread. So I think that validates the model, but it's much more, I think its utility and the real dividend that comes from it is much more once you open, and you've got to keep those numbers very, very low.
Can you quantify what very, very low is?
Pardon, sorry?
Can you quantify what very, very low is?
Oh, well, I think once we get to the position where we can take second and third steps and we start to open.
So we won't see that model essentially rolled out until we get fewer than 5.
No, I wouldn't say that. No, I wouldn't say that. What I'm saying to you, I'm not saying when I can announce that they're established, I'll do that. I'll have no trouble, and I'll be happy to answer any and all questions about that. What I'm saying to you is, in my judgment and the judgment of those who advise me and the government, they will be of their greatest importance, their greatest dividend, if you like, once we're into a situation where the numbers are low, and that localised response becomes really important to keeping them low, so that an outbreak with 20 or 30 cases can be pulled up at 20 and 30 and not become community transmission, chains of transmission that seed from one part of Melbourne to another, and then all of a sudden we're back where we were.
Prime Minister said this morning he was confident Victorian jobs would return in line with other states before Christmas if we get the next steps right. Do you
Yes.
share his confidence for Victorian workers?
I do, and I share an absolute conviction to do everything that we possibly can using the strength of the Victorian budget, well acknowledged by my colleagues, and particularly the Prime Minister himself, use the strength of the Victorian budget to protect household budgets, use the balance sheet of the state to make sure that we borrow at the lowest rate, the lowest cost of capital, the lowest borrowing costs that anyone can remember to repair this unprecedented damage. That is what the Reserve Bank Governor, not just advises, that's what he has told us must happen. Stephen Kennedy, the head of the Federal Treasury, similarly has talked about the cost of borrowing is but a fraction of the cost of long-term unemployment in human terms and in financial terms. So we'll have some very big, exciting, targeted, tailored and innovative policies to announce, and very, very significant investment decisions to announce as part of a jobs plan in our forthcoming budget.
You said a death that's been reclassified. This is the 6th reclassification of a death. How does this occur, that a person gets doubled up?
Well, whether a person was actually COVID affected, that could be one issue. There are reports that come in from private nursing homes, and we faithfully report them to you. And if they were wrong when they were given to us and they get reclassified, then I announce that they have been reclassified. I don't really think there's any alternative.
At the start of the pandemic, the Parliament granted the Victorian Government, I guess, an opportunity to borrow $10 billion in the first financial year and 14.7 in the second financial year.
Yes, about 25 billion.
How much of that $14.7 billion are you thinking we will need to borrow?
Well, the budget will be delivered by the Treasurer on budget day, Samaya.
What day is budget day then?
Well, that'll be announced in due course.
When is due course?
When I stand here and announce it.
And when will that be?
The day that I do that.
Do you not know?
Well, I can certainly confirm today is not the day for me to make those announcements.
Just back on the case.
It hasn't been settled yet. So when it is, we'll stand here and we will announce it.
You decide though.
Well, no, there's a team of people, and we'll make decisions. And when we do, we'll stand up here and announce it.
Just back on the Casey cluster.
There's nothing more or less of that. I'm not here. I can confirm for you and everyone watching, I'm not here today to announce when the state budget will be. But there will be a day I will do that, and then we'll have the budget, and the budget will be delivered. And to Samaya's central point, which was not so much about when the budget will be delivered, but what will be in the budget. And despite her mask, she, I think, is acknowledging that that's the sort of question that you have to ask. And there's no expectation that I'm going to deliver the budget today. That's a job for the Treasurer. And all those matters will be brought to book in that budget, and many matters beyond that.
Our rolling 14-day average today, 36.2.
Yes.
It's obviously a little bit higher yesterday. My understanding is if you take out all the victims or carriers in healthcare and aged care,
yes,
that number comes down to around 11.
Oh, it'll come down substantially because, and if you went even further and you took out high-risk workplaces, then the number will come down even further than that.
And is there not a case for putting, a so-called ring of steel around healthcare,
yep,
aged care?
Sure. Well, I've had this put to me a number of times. We need to accept that there are literally hundreds and hundreds of aged care facilities across the state, so it's not like there's 4 or 5. There are hundreds of public and private health care settings, so hospitals and others, clinics, all sorts of other healthcare environments. That's the first point. Second point is that we have cases beyond that, and you don't need many cases beyond that. So, for instance, the 40 cases in Hallam, none of those are connected to aged care. None of those are connected to a hospital. So you can have you can have a run of this. It can get away from you nowhere near a high-risk workplace. The other point too is that people who work in hospitals and people who work in aged care, they live in families too. They travel, they go to the supermarket, they do all sorts of things. So the sort of spin-off of that question is, oh, well, this problem's in the north and the west. Why don't we just do a hard lockdown there? And you just got to think that through. It'd have to be like a proper lockdown. No one in, no one out. So nurses, teachers, police, all the people who are permitted, factory workers who are permitted to work at this time, would have to stay at home. Nobody would be going anywhere. No one would be going shopping. It'd be a zero reason to leave the house. And even then, that wouldn't stop your Hallam problem, because it's on the other side of town and it's not connected to, best we know, it's not connected to aged care or a health setting. So, look, if you could be more surgical, then you absolutely would. And to a certain extent, once we're opened up, then that's exactly what we will do. We will have that absolute precision focus on individual cases and outbreaks, not closing the whole place down, managing those, because again, it's not a zero-case strategy forever. There will be cases in 21, there will be outbreaks, and they'll be managed like Hallam, so that they're pulled up as quickly as they possibly can be. If we could just do an aged care thing, we absolutely would. Final point on this, aged care is under a pretty strict set of rules now, and I apologise for some of the inconvenience that causes. Family members not necessarily being able to visit, all of those things. But that's for the safety of residents. Hospitals too, I've had a number of people, families, write to me and come to me talking about, they've got loved ones that they can't see and they want to go and see them in hospital. But individual hospitals, particularly when it comes to intensive care, they've made some heartbreakingly difficult choices to keep the rest of the patients in that ward safe by not having visitors coming and going. Tough, really tough. They're pretty well locked down now, many of these settings, is the point I'm making.
Just to go back to the Casey cluster, and I know you've addressed this yesterday and it was a point of discussion the day before as well,
yes,
about the people at the centre of this cluster not being fined.
Yes.
And I understand the reasons, but a lot of people are confused as to why these people aren't being fined, because they've obviously contributed to a spread of COVID-19.
Yes.
And given that we've been in lockdown for so long, people are just frustrated that...
people are frustrated, there's no question about that.
But people are also frustrated that they aren't getting fined.
Well, if you fine people for telling the truth, how do we reckon contact tracing will work then? Like when the person rings up and says, righto, you've got this virus, I'm from the public health team at the Department of Health and Human Services, or I'm from Monash Health, I'd like to take you through over the next 45 minutes to an hour all the places you've been, all the people you've seen. If people are going to get fined for telling the truth in that circumstance, well then I think we know what happens. People won't tell the truth, and we won't know where they've been, who they've infected, and we won't be able to pull up an outbreak at 40. It'll be hundreds. Now, am I frustrated that people are doing the wrong thing? Of course I am. Of course I am. But the truth is worth everything. The truth is how we get out of these restrictions. A $1,650 fine that might make us all feel better because they did the wrong thing and they got fined, that's in the past for a start, so you're not going to change their behaviour potentially. Secondly, you don't get the real riches here is not a fine. The gold, like the absolute fortune here, is getting truthful, honest, complete information so that you can isolate other people, do the contact tracing and pull an outbreak up in the, whether it's 40, not 400. That is the logic, and I'll just put it to you this way. People are free to advance different views on that, but the alternative is dangerous. Without the truth, there is no contact tracing. There is no contact tracing unless people are giving you accurate and fulsome information. And if every time they tell you the truth you're going to fine them, well then they'll stop telling you the truth. And then you can't trace much at all. You can't trace much at all. I'm not expecting anyone to be happy with that. Like, I'm angry with these people. We're all angry with anybody who does the wrong thing. But what they've got to offer of most value is not $1,652 out of their bank account, but information that allows us to drive these numbers down and open the state up. That's where the value is.
Isn't it quite the presumption that the minute someone gets a fine, they suddenly turn into a liar?
Well, if you want to advance a different theory, that people would make free and frank admissions across the board, incurring fines every time they did that, that is not the experience that, I don't think it's reasonable. I don't think it's reasonable. The number of people out of 20,042 cases, so we will have interviewed nearly all of those people. There'll be some that for one reason or another we won't have been able to. But I wonder how many people in the course of those, let's call it, say, 20,000 interviews, would have confessed to having done something that was large or small, not in accordance with the rules. Many, I would think. Their truth and their sense of confidence that they can come forward and tell their story in complete terms, that far outweighs by a factor of the real treasure here, the real riches, are not in fining people for telling the truth to a contact tracer. It's in getting the place open. And if we don't get accurate information and fulsome information, then you won't trace people. You simply won't. And I don't think it's too much to assume. The people probably won't want to get into trouble. They won't want to get other people into trouble. And the thing is this, even if my judgment is wrong, and it's only a handful of people who decide that they'll be less than fulsome to avoid the fine, it only takes a handful. And all of a sudden you've got hundreds and indeed thousands of cases. To suggest, as some have today, that we should do this differently, I think is dangerous. And it will mean that we don't do contact tracing at all. In fact, I don't know what we'd be doing. I really don't know. But it won't be getting patterns of movement and learning about and controlling chains of transmission right across our state.
Has not finding people who admit to breaking COVID restrictions during contact tracing been a feature of our contact tracing system right from the beginning? I
don't think that anyone. No, it isn't new. I think that I'd have to go back and check whether I've answered a question whether it's been as big a point of debate as it's been in the last couple of days. Like, this question was asked on Friday. Everyone in the room, I think, said fair enough. It was asked again yesterday. Now it's on the front page of the paper. That's absolutely fine. That's what newspapers are there for. But let's be clear. If everyone who gets this virus and then gets a phone call decides that they won't say things that will get them into trouble or anyone else into trouble, then they will say less to us than they do now, and we will be able to track less cases than we do now, and that will mean we are closed for longer than we should be. We're not talking about thousands of dollars. We're talking about billions of dollars. That's the cost of not being open. That's the cost of not getting these numbers down and being able to find COVID normal before Christmas this year and lock it in for all of 2021.
We've now had most of the evidence in what the ABC describes as a fiasco, which is the hotel inquiry. How long do you expect to be grilled before the inquiry next week?
I've got no expectations. That's entirely a matter for the process. They'll make judgments as to how long they want to speak to me.
Have you been surprised by things such as Graham Ashton's text about private security?
Well, what I would hope you wouldn't be surprised by is I'm not going to run a commentary on a process that is active. That has been my consistent position. I'll be assisting that process later this week, and I'm not here to run the process that's being run by others. I'm here to assist it. I actually established it to get the answers that we need and that every Victorian's entitled to, and I'm confident that that's what will happen.
Just with the warm weather over the weekend, we have seen a lot of people being out and about at parks and down at the beaches and things. Do you think some people now are really risking taking the foot off the pedal?
Well, the rules changed. Obviously, you've got 2 hours. It's not just exercise. You can go and spend time with one other person. The reports I got last night, Dougal, were, and again this morning, was that by and large people had been keeping their distance. People had been, absolutely fundamentally aware and conscious that the choices they make can set us all back. Or, to be more positive, and we should be positive, on a day with 14 cases, we should be positive about the fact that people are taking this seriously. They're weary, they're frustrated, but they know you can't create your own reality. This is where we're at. These are the circumstances we face, and we need to push through and get this done. And that's exactly what Victorians will do, and that's why I'm so proud of them.
And we've got more protests planned for today. Do you have any idea how much these protests are costing police to run this ongoing operation to round up protesters?
No, I don't, but I could try and come back to you. I'm not sure whether they would be able to disaggregate a lot of these police. Well, in fact, all of them are basically permanent employees. They're part of the biggest police force our state's ever had. That's where we find ourselves today as a result of the recruitment that we've done over these last nearly 6 years. Look, Victoria Police are doing a very good job in very difficult circumstances, and there's a few out there criticising them, but look, Victoria Police are there to keep everyone safe, and they have my full support. The work they're doing is tough work. Some of these ugly scenes, they can be avoided. Don't protest. It's unlawful. It is unlawful, and it is selfish, and it can achieve but one thing, and that is the potential spread of this virus, and that will set us all back. And it's not just COVID protesting, any protesting. Doesn't matter what you're protesting for or against, don't protest. Go home, stay at home, follow the rules, and then you'll be able to do all the protesting you like at some point in the future when we've got rules that allow that, and we've got a very different set of scientific and medical facts to deal with when we're in a different place when it comes to this global pandemic.
There's some commentary in The Age today from the Vice-Chancellor of Melbourne Uni. He says it boils down to a basic, very hard moral philosophy. What's the value of a 90-year-old's life versus the value of the continuing livelihood and happiness of a 25-year-old?
Well, I'd agree. I would agree with the Vice-Chancellor that they're very difficult judgments to make. But I would have to, in being in no way critical of the work that Duncan's done, but I would make the point that in October, we're about to go into October last year, there were 1,000 people who required urgent critical care in one of our Victorian hospitals because of a heart attack. In October last year, there were 1,000, a bit more actually, just over 1,000 people across Victoria who needed critical care because of a stroke. That's got nothing to do with COVID. And they're of all ages. Those conditions, cardiac conditions, stroke, not to mention time-critical urgent cancer care, whether it be surgical oncology, medical oncology, radiotherapy, the whole thing. If your health system gets swamped, then all those people miss out too. That's not to mention workplace injuries, trauma as we call it, workplace injuries, car accidents, all these things where you need an ICU bed. If every ICU bed is full with a COVID patient, then those people miss out too. So the judgments, it's not just about it's not really a debate that I'm all that interested in getting into. I think every life is precious, and I think that it's a very fine line, I think, in trying to weigh up whether someone who's in their 60s, 70s or 80s is more or less worthy than someone who's younger. But that you don't have to get to that debate, because what I'm saying to you is the evidence tells you if your health system gets swamped, people of all ages, all backgrounds, and for all reasons will miss out. And they're not people who can afford to wait. If you've had a stroke, if you're having a heart attack, you need care and you need it now. And a swamped health system will not be able to deliver that for you.
What do you imagine is in the headspace of a 25-year-old who's been in lockdown? I mean, you mentioned earlier that you read or you saw some correspondence from people about how hard it is with their families in aged care. Do you read letters to you, and how do you gauge how hard it is?
I think every Victorian, regardless of their age or their circumstance, wants this to be over. And the key point here is to stay the course, and when it is over, make sure that that is meaningful and real, and not some temporary sense of elation that we're open again, only to find out pretty soon after that we opened too much too quickly. So I think it doesn't matter which part of the state you live in, what your age is, what your circumstances. I think everybody's frustrated, but everyone, the vast majority of Victorians are doing an amazing job. And they want, in my judgment, what they tell me is they want everything they've given to count for something. They don't want a situation where we get to the other side of this and everything they've done, every sacrifice they've made is worth naught because we did it too quickly. That's the message I get, and I get it everywhere I go. Not happy to be in the position we're in, but absolutely committed to this recognition that the only way out is to do this in a safe and steady way, and in a lasting way.
When you say you get that message everywhere you go, I thought you were only ever here or at your house.
Well, there's a lot of, and I interact with the rest of the state via Zoom and various other platforms.
Any people
Just
who
in
are
case
not...
you thought I was travelling around the state.
No, sure. I've had people suggest that you've had a haircut, and I don't think you have.
No, Catherine gave a very, very mild haircut not so long ago during the course of this week. There's photos if anyone needs evidence that I didn't go to a park and have an illegal haircut. It was an appropriate haircut. Well, you can be the judge of that, but it was within the rules anyway.
I dismissed this hairdresser who messaged me as being wrong, but is that the first time she's done that?
Yes, it is.
How would you?
But it may not be the last. Some of us are blessed with a less intensive maintenance challenge than others.
I cut my own.
Well, indeed.
So yeah, do you talk to? Have you tried to talk to voters outside all the officials and bureaucrats that you speak to?
I live in a family. I live in a community, and I talk to lots of different people. I do more listening than I do talking, and the message is this: do it and do it properly. Let's get out of this. That's what people tell me they want, and again, that's what the science tells you. It's what common sense tells you. If we can, again, I'll stay here as long as you want, but be clear. There's no getting around this central fact. Unless you get the numbers low, you've got no chance of keeping them low. That's where we're at. This is working. This is a day to be positive, to be optimistic. We are on schedule. We may even be a bit ahead of schedule. But we've got to keep going. We've got to keep going. And that's why I'm so proud and grateful of every single Victorian who's doing the right thing. It's making a difference. It's working. The time very soon will come for us to begin a massive, massive project of economic investment to protect livelihoods, to set us up for the future, and to make sure 2021 is an infinitely better year than 2020. That's where we're headed, and we will get there together, provided we all accept the circumstances we're in and stay the course, find it in ourselves to have the resolve and the strength, and I know that Victorians have it in them. This state has confronted so much adversity in the past. This is unprecedented, but if we draw on all of those skills, that spirit, that strength, then we can be optimistic and we can be confident that we will defeat this second wave and do it properly so that there isn't a third one.
I've got some questions on PPE, sorry.
Yes.
Why do we still not have enough N95 masks for all COVID health workers?
I saw some commentary about this in relation to fit testing. All I can do is get Andrew Wilson, the Chief Medical Officer, to come back to you, and I will arrange for that to happen.
Has supply dictated how those masks are rolled out?
I don't believe so. We have massive stockpiles in lots of different gowns, gloves, shields, masks, and there are different types of masks, all of that. As to the detail of that, that's not something that's managed by me. In that there is a team that does that. I get reports, and I'm obviously concerned about it. But the person who I think can best answer those questions is in fact the Chief Medical Officer.
Just to be really clear, your earlier comments, if we are ahead of schedule, will you consider revising the roadmap and changing those dates?
We will be guided by advice, we'll be guided by the data, and we'll be guided by what is safe.
So you're not ruling it out?
I've never ruled that out. I've been very clear about the fact that we would always be guided by those three things: the evidence and the science, the data, and what is deemed safe. The 28th will be the 28th. That's not going to get brought forward, because we always said the number or the date, whichever's later. I suppose what I'm really saying to you is I can't predict where we'll be at the end of October, and I can't predict where we'll be at the end of November. The model, with thousands of inputs, 2 universities, some of the best data scientists that you can find, it predicts that it will be the end of October and the end of November, but every day that passes sees assumptions that were made in good faith replaced by actuals, real data, the actual experience that's out there. And data always trumps modelling. It's as simple as that.
Can I go back to PPE
Yes.
or fit testing? We've been told that there are, limited supplies of small N95 respirators. Is there still a shortfall in small N95 respirators? And does it mean that someone like healthcare workers, have they been working with coronavirus patients wearing N95s? That's right.
The best thing for me to do is to get Andrew Wilson to speak to you about the fit testing trial out at Northern Health and any other PPE trends when it comes to those sorts of issues. If he, or to put it another way, I'll get you an answer. I don't have that answer, but I'll get you that answer, because it's a very important issue.
Just on the swamping of hospitals and
Yes.
ICU beds, if we let COVID just run its course, obviously we experienced an influenza pandemic in Australia last year,
Yes.
also in Victoria.
Yes.
How did that affect our hospital's ability to be able to cope with both influenza patients but also other like heart disease, stroke
Sure.
patients, etc.?
Well, there's a couple of points. This is not the flu, because we obviously have a vaccine for the seasonal flu.
But we
This
still
is
had lots of
this.
flu cases.
Oh yeah, this is substantially more infectious than the flu, and it has a substantially higher mortality rate than the flu. That's not to say the flu is easy though. The flu season, winter, is very challenging in our health system every single year. Even a mild year for flu sees many people wait longer than we would like for the care that they need. I can drag out for you the hospital services report that'll have monthly, quarterly data that'll talk about last year's impacts, and you'd see a whole range of key performance measures that would be lower than perhaps the year before, because it was a particularly bad flu year. However, I think we need to be cautious in transposing that to what an out-of-control coronavirus environment would look like, because it's next level in every way. And, I don't have the data. I've asked for it a few times. I'll have to go back and check where it's up to. But if you look at time-critical urgent care in New York, in parts of Italy, parts of Spain, parts of France, you'll definitely see impacts. If you're swamped, you are swamped. And that means that people will not get the care that they need as fast as they need it. But yeah, it was a difficult year for flu, but this is even more difficult again. That's the challenge.
I also wanted to ask about the 4-step roadmap.
Yes.
Obviously, the next stage is having between 30 and 50 cases, and the step after that is having fewer than 5 cases.
Yes.
Will you consider making it a 5-step roadmap and maybe, easing low-risk restrictions between
Sure.
29 and 6 cases?
All of those things are reviewed constantly based on the numbers and the narrative that sits behind those numbers, and how successful the strategy is. And you only have those options available to you, and I'm not here today to make any announcements about that, but we only have those options available to you if we all stay the course and we drive these numbers down. And 14 is a very good number. It's a very good number. But let's not forget the fact that there are 5 families who are planning funerals as we speak. So this is not a simple thing. It's not an easy thing. I understand that. I understand people are frustrated. That's why I'm so proud to think that people are finding a way to move beyond that and to absolutely acknowledge that this is our reality. There's no wishing it away. We just have to stay the course and get this done.
Can you just walk us through the logic of not having a dedicated step for cases that are between 60 and 29?
Sorry, what? Sorry? I'm not quite following, Smart.
Sorry, the second step,
Yes.
to go to the second step, we need to have between 30 to 50 cases, and the third step is having fewer than 5 cases.
Yep.
I was just wondering if you could walk us through why there isn't a dedicated step in between to cater for the cases.
Well,
between 60.
if you look at what the step that we hope to take on Sunday, effective from Monday, if you look at the nature of those changes, they are deemed low risk. They're not principally, well, you've got about 100,000 workers going back. You've got cumulatively, you've got some additional social activity, things of that nature, but they're limited. So it's about what you can do as quick as possible, and some of those things were deemed possible, provided we got within 30 to 50. Then when you start to take much bigger steps that involve the movement of millions of people, it's appropriate that the tolerance or the case number that you've reached is lower. If you brought the actions from the third step back to this Sunday, well then 30 to 50 would not cut it. You'd have to have delivered something close to that 5 cases a day, if that makes sense.
No, I meant, sorry, we have 100,000 people returning to work in the next week, and then
Yes.
millions October 26 or whatever date we deem it to be. I was just wondering why there wasn't let's say 500,000 people return to work, why that isn't in its own step, or why there isn't a step between step 2 and step 3.
Well, there may well be. We just probably haven't quantified what the next lot of returning industries, how many jobs can be attributed to those. If we can get you any further analysis on that, we will.
If we go to Sunday 28th, we go to the next step, will the curfew remain in place, and how long for?
Curfew will be there for as long as it assists police in enforcing these rules. And to be honest, there's been I've made some comments about this, and I'm not all that interested in going back over it. But ultimately, as it stands right now, curfew is out to 9 p.m. till 5 a.m. And by my reading of it, the things that would impact you, the things that would stop you doing, because of course, whether there's a curfew or not, you can't do unlawful things. You can only follow the rules. It means you can't go for a jog at midnight. You'd have to have your jog done before 9 p.m. You can't go shopping after 9 p.m, but many of the shops are closed, and they were closed long before the curfew. So that is an impost, and to the extent that that's a massive issue for people, I very much regret that is an impact. But it is absolutely driving down the amount of unlawful activity, people going and visiting other people doing things they shouldn't be doing, that only spread the virus. The key point here is let's make the job of police, which is very challenging, let's make it as simple as it possibly can be. There'll be a time for that to come off, but to the extent that it's contributing to the strategy, and I think it is, it's the appropriate thing to leave it there, with that extra hour.
Yesterday we found out that you wanted the hotel to be at an airport near Melbourne, at a hotel near Melbourne Airport, and for the 80 Greg Mortimer cruise guests to go to that hotel. Is there any reason why you wanted that?
I'll be assisting the inquiry later this week, and those questions are the whole issue is appropriately canvassed in that forum. I'm not going to be trying to run that from this podium.
I'm not asking you to, with all due respect, run anything from the podium.
And
just wanted to know why you thought
and
it would
can
be
I
more
respectfully say to you that
appropriate.
it's not appropriate for me to, with the utmost of respect. I know why you asked the questions, no problem with that, but it's not appropriate for me to be doing that from this podium, when I'll be assisting the inquiry in just a few days.
Can you ask about live music?
Absolutely you can.
Okay.
No, you,
I was going to ask Martin about live music, but I can ask you about live music.
midnight oil, don't you know that? Martin's going to answer all that.
Thanks.
Yes.
Can I just ask how the venues were chosen?
So they had to apply, and there was a sliding scale depending on a whole range of criteria which are available at Creative Victoria's website, and Based on that criteria, we had hundreds and hundreds of venues apply. The first tranche of those has seen 106 venues share $9.6 million in COVID-ready, COVID-safe work, and we'll have more to say about the second tranche as we go through the many, many applications, as you would expect in the live music capital of Australia.
How many applications did you have up until the decision?
I'd have to get that figure for you, but given that we've got a second tranche working its way through the system, the first 106 are out the door tomorrow.
When will they see the money?
They'll start to see the money between now and as they get their COVID-safe plans ready, October, November, December. Some of them are small venues, very small venues. Some of them are in 1,200 and above punter type venues. So it will depend on the nature of the venue. But the criteria are all set out there in the most transparent possible way, and those venues, I know already, some of the words already got out, are looking forward to sustaining jobs. A small venue in Footscray that I'm aware of, the Pride Bar. The operator confirmed this morning that this announcement saves 17 jobs today. And you multiply that across 106 venues, big and small, this will underpin thousands of jobs that might otherwise have been at risk. It will also allow us to come back at a more rapid pace with COVID safe and COVID normal plans to drive music and the fun of music as a key part of Victoria's comeback.
We're coming into festival season. Obviously that will look a lot different, if at all. Why not include festivals in this?
Strange you should say that. The Australian Festivals Association also gets some money in this package to assist them in the development of COVID safe comeback plans, probably from December onwards, if we achieve the COVID safe measures that all Victorians have sacrificed so much to achieve.
Venues, live entertainment. Sorry, just one final question. Live entertainment was one of the first things to be cancelled at the start of the pandemic and probably one of the last to be reintroduced. I guess, is this money actually enough to sustain some of the just surviving businesses that there are at the moment?
So this $13 million package today now brings to some $90 million through the creative industries portfolio to sustain the creative ecology since the March 15th closure of the sector. That does not count all the work that the Treasurer has put in and that the Minister for Liquor Licensing has put in and that the Minister for Employment has put in terms of licences, payroll tax, refunds of a whole range of other business taxes and levies. I'm not sure what those figures are. I'm sure the Treasurer would be able to share those with you. But you add all of that together, in response to unprecedented challenges, this government has stepped up and got out a whole lot quicker and a whole lot more support to the creative sector than any other government around the country.
I'll just finish by saying that we'll have more to say in relation to live music and the creative industries quite soon as well. This is going to be a summer like no other when it comes to outdoor drinking and dining, finding that COVID normal. There are great opportunities for us to do much more to support that sector. It's such a big part of our identity, and we'll have more to say about that soon. In terms of the final message, if there's no further questions, if there's one thing you do today, please get tested. If you've got any symptoms whatsoever, don't put it off till tomorrow. Get tested today, and that'll help us keep you safe, your family safe, and it'll help us get to the COVID normal that we're all desperate to find as soon as possible. If there's no other matters, thank you, and we'll see you tomorrow.
Thank you.